It's a pleasure to have you all here. Thank you for joining. What are we doing here? Our objective here is to share with you. Our objective here is to share with you what we have been doing with supply chain for the past 10 years, as I mentioned, with the Nigerian Ministry of Health, with Kenya, and now as well with Rwanda. We are we have been supercharging supply chain for a while on the public side, and we have decided that let's take it out to the private. In addition to that, we are working with donor foundations who have empowered us to be able to distribute maternal health innovative tools to every single place in the whole of every single city, every single state in the whole of Nigeria. We will be doing this. We have started doing this in the last quarter of December, and we'll continue to do this. So, what is the objective? What is the current objective of this series? We are open to share with everybody here that innovation to maternal health is not a one-time thing. Innovation to maternal health is not a one-time thing. It's everybody. You can go to the next slide. Thank you. It's a comprehensive approach. We want to share that beyond. We want to be able to show. Please go to the slide before this one, Jay. All right, thank you. So we want to be able to show to everyone that there are several innovations that are coming in place now, and we want to make it available. We have been empowered to make it. We have been empowered to do this, and we are ready to ensure that any innovation that comes in terms of maternal health, we make it available to you through tech in the most seamless way possible, right? We also want to show you at the end of the series that it's a comprehensive approach. It's not going to be one thing meets all. There's going to be some system level change. Meaning some of the processes that are happening in hospitals, they need to be upgraded. Not that anything that we are doing is bad. It's just that maybe some things that we are doing it because we don't have some things available. For instance, cold chain is not available. What is the alternative? Or how can we help in terms of financing? How can we help with that? We have all that available as well through this series. We believe that when there is knowledge, anything can happen. You just like we were at a program yesterday with SFH when they were talking about empowering mothers. Empowering with knowledge can make anything happen. Evidence-based solutions will be sharing with you the solutions that we are bringing. Why are those solutions? What is backing it? Is it just from us, or does it have some other science attached to it? And then finally, accessibility. There is nothing as important as learning about new things and then not being able to get it. You will be able to get everything that we are sharing here. Next slide, please, Jay. So the series, as I mentioned, it's a series. We have 4 series already. We'll be issuing a certificate of completion for everybody that joins. And as I said, it will be getting better. For instance, the one on the 30th of May, for all of us that are joining here, you will get, you'll be the first to get access to that, the information about that. And we are working to partner with SOGON, that's the Society for Gynecologists in Nigeria. We're working to partner with them. And as it moves on, each series, each episode will keep getting better than the next. The next slide, please. So please mark the dates and we'll share this with you. Some of the data that I just want to share with you, my colleagues will be sharing more. As I told you, we have experts here, supply chain experts, procurement experts, pharmacists, and all other professionals that will be sharing with us in this short period that we have here. Not just information for Nigeria, Kenya, and other parts of West Africa that we have been empowered to distribute last mile delivery for free. So we know with data has shown us that instead of the staff to be doing exactly what they should be doing in the hospital, they are looking for supplies. I'm a pharmacist. I've worked at UCH before, and I think I was telling this at the last ANPMP conference, where I was talking about a colleague of mine that was slapped by a patient just because she had waited so long to get it. or is it a pharmacy that you have your pharmacy shop, you have bought supplies, but because somebody has not arranged the supplies well, people are coming in and saying, I want to buy, but then your staff is telling them it's not available, but it's actually available. They just didn't store it well. That is part of supply chain. you know, inefficient storage mechanism or storage strategy is part of supply chain. Procuring when items are in season, like full season, procuring when they're in season or out of season is part of supply chain. How are we using tech to help you? How are we using help tech to help in terms of maternal health? We'll tell you. Another data showed that 3.8 billion is lost. And this is just Nigeria. You can imagine what is being lost in other places just because there's inefficient supply chain in the health sector. At least I'm aware that for now, a huge part of West Africa is still paying out of pocket for healthcare. So that means the health sector is still more expensive to the government and even to us than it should be. So supply chain should not be a problem. And every shortage can lead to a loss of life or compromised care. So that's why we now looked at, okay, at Shelf Life, we're already doing this. How do we laser focus what we are doing with respect to maternal health? So that's why we now introduced what we called Safe Motherhood Powered by Field. So Safe Motherhood Powered by Field, it's a program where we have a vision, and our vision is that healthy mothers deliver healthy babies. At the program, I think it was yesterday or day before yesterday, the special advisor to Lagos State Ministry of Health, she mentioned that, she said, no child is left behind. We are appreciative of our fathers, but we know that they need to be out there to be working. We know that they need to be working. The mothers too need to be working, but who is carrying the baby full time? Who is bringing out the baby? They say, I can't watch my infant head when sleeping on my cradle bed. It's the mother, right? While the father is braving the elements of the world to bring money in. So no babies left behind. No mother should die on the bed. So what we are doing with our program, Safe Motherhood Powered by Field, is that we are accelerating new and old therapies into practice. We are financing your ability to get this and also providing cold chain access. And then we are providing comprehensive and supply chain solution at scale. I know I mentioned to you that there are different aspects of supply chain. It's not just, there are different aspects of supply chain. It's not just somebody supplying to you. Somebody's supplying to you. It's all about it. Even the money, even being able to get it to you wherever you are. It's all encompassing.